Good afternoon and welcome to today's webinar, Water Justice, Community Health, and Sustainable Communities. I'm Matt Reese, GreenGov Deputy Director. Today's webinar is co-hosted and supported through our partnership with the Penn State Sustainability Institute. The GreenGov Council was established through Executive Order 2019-01, which requires Commonwealth agencies to lead by example, promoting energy conservation and sustainable governance. The executive order sets forth goals for the Commonwealth, including the goal of achieving 26% reduction of greenhouse gas emissions by 2025 and an 80% reduction by 2050. The executive order created additional goals for agencies focusing on fleet electrification, high performance building construction, annual energy reductions, and use of renewable electricity. Please feel free to visit our website at dgs.pa.gov/greengov to see how agencies are meeting these performance goals. You'll find a host of information on the website, including completed agency certification checklists, past annual reports, GreenGov news and sign-up opportunities for the newsletter, quarterly newsletter, and other future webinar series events. Now I'd like to introduce our friend, colleague, and partner at the Penn State Sustainability Institute, Peter Boger, PhD. Peter is the Assistant Director for Community Engagement at Penn State University Sustainability Institute, and is responsible for developing strategic programming and partnerships such as this one with the GreenGov Council that help Penn State leverage its resources to promote sustainability throughout the Commonwealth of Pennsylvania. Thanks, and take it away, Peter.
Thank you so much, Matt, and thank you everybody for joining us today. We are delighted to have all of you for this ongoing conversation and are really privileged to be part of this ongoing partnership with the GreenGov Council. The Sustainability Institute is the sustainability office for the entire Penn State system, all 24 campuses across the state. And our mission is to institutionalize sustainability into all aspects of Penn State's workings, whether that's teaching, research, operations, community engagement, or student engagement. And like the GreenGov Council, we see ourselves as very similar in their mission with the state. We are both small institutions, vastly smaller compared to the size of the institutions that we serve. But that means that our mission is not to be the owners of sustainability, but to instead be catalyzers and conveners in sessions like these GreenGov webinars to help bring people together and to provide the spark to help other people take ownership of sustainability in whatever it is you do with your work. We are privileged to be in our fourth series now with the GreenGov Council on these webinars and are looking forward to this partnership and are especially delighted to have today's session on water justice, which is very appropriately timed given the recent news with the train derailment in Ohio and people's fears for what its impacts are on water. World Water Day coming up next Wednesday, and a host of other things that are making people more and more conscious of connections between water and health. And so it is with great privilege that we are honored to have Dr. Asher Rosinger here today as our speaker. Dr. Asher Rosinger is an assistant professor of biobehavioral health and anthropology and is the director of the Water, Health, and Nutrition Laboratory at Penn State University. He is a human biologist and epidemiologist with expertise in water insecurity, human water needs, hydration, cardiometabolic and kidney health, and environmental health. He has unique interdisciplinary training in longitudinal studies in human biology through anthropological training, water quality training through an internship at the EPA, and field epidemiology through the CDC's Epidemic Intelligence Service Fellowship Program. Oof. Overall, his work addresses the fundamental question of how individuals and populations meet their water needs and how this affects health and well-being. He explores predictors and consequences of water insecurity and water quality on health and human biology, as well as the adaptive coping strategies people use to mitigate these water problems in everywhere from lowland Bolivia to northern Kenya and right here in the United States. So I think you can agree we have an incredibly well-qualified speaker to talk to us today on water justice and sustainable communities. And with that, I give you Dr. Asher Rosinger.
All right, thanks so much for that kind introduction, Peter. I'm excited to be here. And today, what I'm going to talk to you about is the issue of water insecurity. Starting first at a global scale to give you a bigger picture of, how big of a problem this is worldwide, and then narrowing in a bit into the United States. And then finally, the last half of the talk, I'll focus in on our work here in Pennsylvania to really discuss how this is affecting community health, both from the social perspectives as well as the public health perspectives related to clean water. with a heavy emphasis on private water sources. So to give you a little bit of a background about me, Peter did a great job, but here at Penn State, I direct the Water Health and Nutrition Lab, in which I work in northern Kenya in a very remote population that lacks access to clean water. They deal with water scarcity problems. I also have been working in lowland Bolivia since 2009, and then I've been analyzing complex survey data in the United States to understand nationally representative trends. And over the last few years, since I've come to Penn State in 2017, we've been trying to understand water insecurity here in the Commonwealth. On a global level, there's still 2 billion people that don't have access to safely managed drinking water due to socioeconomic inequalities, infrastructural aging, and higher frequency and intensity of dangerous climatic events. Water insecurity can manifest in several different ways. Water scarcity, or living in places without enough water. This is what we most commonly think of as water insecurity. But it can also be the inverse, living in places with too much dirty water or that may flood, as well as dealing with water contamination issues. So water problems aren't isolated to low-income countries. There have been a number of recent water infrastructure crises here in the US, and in this talk, I'm going to particularly focus on the US since this is the focus of this talk today. But it's also important to note that water problems are only expected to get worse with climate change and extreme climatic events. We've seen how flooding and drought are both occurring at higher rates and higher frequency, not only worldwide, but here in the US. We had California that was dealing with the worst drought in 1,000 years, and now they're dealing with historic flooding. And so this has important implications for water security and many facets of health and human biology. Water is the most basic physiological need, which links biology, culture, and the environment. And to give you a little snapshot of what I do, is my research is really driven by 2 primary questions. First, how do water needs and experiences surrounding water affect human health through trade-offs in nutrition, stress, and disease risk? And in turn, how do interactions with physical and nutritional environments shape human adaptability and variation in water needs? In essence, what are the strategies that people are using to buffer risk? One of the frameworks that I use to understand water problems is water insecurity. And the way that we define water insecurity is really through an experiential lens, as opposed to a hydrological lens that a lot of people are more familiar with. Water insecurity is defined as the inability to access and benefit from sufficient, reliable, and acceptable water for well-being and a healthy life. And when we think about water insecurity, there are really 4 primary dimensions of this. Physical availability, so availability of water. Is there water present in the environment? Second, accessibility. If there's water in the environment, can you get to that water without physical barriers, economic barriers, cultural barriers, political barriers? Now, if there's physical water available and it's accessible, the 3rd dimension is use. Is it possible and acceptable for one to drink, bathe, or irrigate that water? And then finally, the 4th dimension is reliability, or how stable the other 3 dimensions are over time. And when any one of these 4 dimensions are not present, water insecurity occurs. The majority of research has really assessed how water insecurity is associated with psychosocial stress and mental well-being, discussed as suffering for water and suffering from water. But less research has examined physical and chronic health outcomes. My research program has really been aimed at understanding the human biology implications of living with water insecurity at various stages throughout the life course. During infancy, water insecurity can affect risk of diarrhea, dehydration, and stunting, or short height for age. In childhood, it can affect dehydration it can alter the gut microbiome, and it can affect cognitive performance. During pregnancy and lactation, water restriction can lead to higher psychosocial stress, physiological stress, and that can actually affect fetal homeostatic thirst set points, as well as lead to smaller fetal body size. And this may point to intergenerational effects of water insecurity. In adulthood and late adulthood, proxies of water insecurity are associated with reduced kidney function, blood pressure, high blood pressure, hypertension, as well as food insecurity and stress. And these are some of the leading causes of morbidity and mortality worldwide. So how do we measure water insecurity? Well, cross-culturally, we've developed a scale to measure experiences of water insecurity. But in the United States, this experiential scale of water insecurity hasn't really been developed yet or validated. So one of the things that I've done is I've looked at tap water avoidance as a proxy for water insecurity. That is, when people don't drink their tap water, that is most commonly due to distrust of their water source or fears that it might be contaminated. One of the things that I did, I published a paper this past year that was the cover of the Journal of Nutrition, in which I used dietary recall data to provide a window into US water insecurity by using this tap water avoidance as a proxy. And when we do that, we can look at really important trends in the United States. So to give you a snapshot of what the data source came from, you can look at nationally representative issues in the US using data from the National Health and Nutrition Examination Survey, or NHANES. They conduct interviews and physical examinations to monitor the health and nutritional status of the civilian, non-institutionalized household population in the US. Now, NHANES uses a complex multi-stage probability sampling design to create this representative sample. And participants will come to the mobile exam center shown here after a household interview, where they complete physical examinations and dietary interviews. And by analyzing this data, we can actually look at trends over time that's nationally representative to the US, but is not necessarily specific to any one geography. The issue of whether people can trust their water has become increasingly important in the US, as access to water that meets water quality standards often falls along race, ethnicity, and socioeconomic boundaries. For example, adults that live in mobile home units often have less reliable access to water services, which may shift consumption from tap water to bottled water. Additionally, high visibility events like boil water advisories, crises, and shocks to systems can increase distrust of tap water, as we've seen recently with the Flint, Michigan water crisis, as well as the Jackson, Mississippi water crisis, and most recently, just a month ago in Ohio, in East Palestine, Ohio. When we use NHANES data, I've published a number of papers on this where I've looked at trends in tap water avoidance. So what these two figures are showing you are that between 2011, 2012, and 2018, among children and adolescents in this panel, and then adults in this panel, and on the y-axis, we're looking at the probability of avoiding tap water, we see two things. The first is that there are large disparities in who is avoiding tap water. The green line that's the top are Hispanic children, adults, and then the second line are Black children, adolescents, and adults, and then Asian adults in the light blue, and then non-Hispanic white adults in the bottom lines. And what we see is that there's huge disparities. So non-Hispanic whites are significantly less likely to avoid their tap water than Hispanic and Black households in the United States. So we see, first of all, huge disparities where Hispanic and Black communities and households are not drinking their tap water. Second, when we look at one of these huge shocks in the United States, the Flint, Michigan water crisis, and that started in 2013, 2014, after that moment in time, we've seen nationally that there have been huge increases in tap water avoidance. What this ends up meaning is that with the latest data from 2017, 2018, approximately 20% of US adults and children do not drink their tap water. And that translates into 61 million people. So 20%, 1 in 5 do not drink their tap water. And Hispanic and Black adults are about 3 times more likely to avoid their tap water. So why do we care about that? Well, why this matters is that when people don't drink their tap water, they're more likely to drink sugary drinks. And in fact, I've shown that those that don't drink water consume twice as many calories from sugary drinks as water drinkers. And this is bad because sugary drink consumption is associated with weight gain, diabetes, and cardiometabolic disease, as well as all-cause mortality. Next, one of the things that I've recently shown is, and this paper just came out in an issue in January of 2023, was we wanted to understand, well, so if you're dealing with water insecurity in the US as using this proxy of tap water avoidance, what does that do to food insecurity? Because if you don't trust your tap water and you're buying bottled water or you're buying sugary drinks instead, it's a lot harder to cook. And in fact, what we found was that when people avoid tap water in the United States, that increases their food insecurity by 19 to 30%. And this has been increasing over time. And again, I just want to note that we see this huge increase in food insecurity among tap water avoiders compared to people that drink their water. So at a national level, water insecurity has been increasing tap water distrust, particularly among marginalized and minoritized communities, and this has nutritional and health consequences. Okay, so that's the national level. Let's transition to Pennsylvania. I want to first highlight that since I think we started this in 2019, we put together an interdisciplinary team of Andy Warner, who's the water initiative lead here at Penn State. He kind of reached out to me, reached out to Laura Fowler, Brian Swistock, Dave Yuxtheimer, and then we then subsequently reached out to Mari Kelly and Ryan Baxter, and my graduate student I brought on board, Leslie Ford, to try to understand what is going on in terms of water insecurity here in Pennsylvania. And so through a series of internal grants at Penn State, we've done a series of steps. So I'm going to share some of the research that we've done to date here in Pennsylvania. Why Pennsylvania? Well, a lot of you are probably familiar with all of the issues that go on in Pennsylvania, but we really view Pennsylvania as a microcosm of the broader US. There are a number of really interesting issues going on here where we have fracking, we've got mining, we have a large percentage of the population that relies on private water sources. We also have 2 huge urban centers that deal with disparities in health. So we wanted to bring all this together. So some of our baseline questions were things like, what information do we know about private water sources in Pennsylvania? What is water quality like? Then we also wanted to understand some systematic literature reviews in terms of what's been studied in Pennsylvania as it relates to water insecurity so far. What are the legal protections? And then the last couple of things that we've just started to work on, I'll touch on at the end, relate to distrust of drinking water here in Pennsylvania, and then what are the health consequences. So a little bit of background. Water insecurity is a big issue in the United States, particularly for household well users. And the majority of people that rely on household wells actually reside in the eastern part of the United States, where you can see in this map, this is the number of people in each county that use household wells. And Pennsylvania is quite representative. What are some of the challenges of household wells? Well, if there's poor well construction or siting, potential contamination from various sources, There's the potential of high levels of bacterial contamination like E. coli and fecal coliforms, as well as nitrates and other contaminants. There's the potential for lead impacts. And frequently, there's limited testing, which can be expensive. It can be hard to understand. And recent research, not so research, but EPA research found that 1 out of every 5 household wells may exceed a human health standard. And furthermore, wells they lack federal regulation in terms of water quality. The Safe Drinking Water Act doesn't actually provide protection for private household wells. They primarily examine municipal sources. And so the standards for the Safe Drinking Water Act are aimed at understanding the maximum contaminant levels at which a constituent may affect public health, and then the secondary maximum contaminant levels at which a constituent may begin to affect the aesthetic qualities of water. So you can think about the taste, the smell, the color. And just a couple days ago, the EPA announced that they will start to regulate, hopefully, forever chemicals like PFAS and PFOAs. But these drinking water standards only apply to public water systems and not to individual private wells. And so this is actually, the onus of testing is on the homeowner. Now, what's really interesting is that water insecurity is this really big problem in Pennsylvania because about a quarter of the Pennsylvania population relies on household wells. When we look at the top 3 by population states that rely on wells, Michigan is number 1 at 2.5 million people that rely on household wells. Pennsylvania is right below them, and then third is North Carolina. And then the top per capita state is Maine, where about 38% of their population rely on wells. So as you can see, about a quarter of Pennsylvania is relying on wells, and that's a large percentage of our population. And just to note that, I'm calling them household wells, but these are also known by a number of other names like private wells, backyard wells, domestic wells, residential wells, but we're talking about these private water sources. When we think about where Pennsylvania lies as it relates to other states in the United States, we're 29th right now for achieving the Sustainable Development Goals, one of 8 states where they found significant challenges remain for clean water and sanitation. So in terms of the 2 indicators that we're really worried about, water pollution and people drinking unsafe water. So Pennsylvania still has a long way to go. What are some of the challenges that we're dealing with? Well, some of the existing concerns regard acid mine drainage contamination on surface and groundwater sources. This is a map showing abandoned mine drainage impacted streams in Pennsylvania. And so, we're in Centre County, and even in Centre County, you can see, and Clearfield County, you can see that there is a lot of abandoned mine drainage, which can impact streams and the water quality, and those can easily get into well water. Second, there are potential impacts at household wells, which are amplified by hydraulic fracturing or fracking in some parts of Pennsylvania. And you can see that this has been an increasing issue over time. So this map is showing you the year in which wells are drilled, and the dark purple and light purple are wells drilled since 2016 to 2019. And there have been over 4,000 new wells hydraulically fractured in just the those 4-year period. So what did we do? That's a bit of background of why we are concerned about this. Well, luckily, we were very lucky to be one of our partners, Susan Bozer and Brian Swistock, were both working with the Master Well Owner Network, and Penn State Extension is a tremendous resource that we've been working with in our project. We were able to compile individual water samples from wells to better understand what does the water quality look like along different water quality contaminants of human health concern. So I'm going to show you some preliminary results from some of our mapping over the next few slides. And what I'm showing you is water quality testing data from just over 15,000 water quality samples, so a big amount. But the information was assembled by zip code for privacy protection. And areas where there's fewer than 10 samples are indicated with hatching lines in the map. And so it's important to understand that, if you only have 10 samples in an area, it might not necessarily be representative of the entire region. Also, these samples are from over the last 15 years or so. So the water quality that we saw 15 years ago is not necessarily indicative of the water quality right now today. Just a couple caveats. Okay, so the first water quality indicator that I want to show you is nitrates, which are an issue of significant concern in Pennsylvania. And nitrates above 10 milligrams per liter is considered a health failure. So this first map that I'm showing you on the left is indicating nitrates, the average of all water samples per zip code throughout Pennsylvania. And the dark orange are the levels at which we're seeing close to the maximum contaminant level. And if we then look at the percentage of water samples that failed per zip code, we can see that in a few regions, although most of those are indicated with hatching lines, so fewer than 10 samples, we do have a number of places where the water samples failed they were above the maximum contaminant level in these private water sources. Second, you can also look at fecal coliforms, which I'm not going to show you right now just for time, but E. coli is a better indicator of fecal contamination in water sources. The CDC and the EPA, their cutoff is 0. So any amount of E. coli in your water is not good. It could potentially lead to some sort of fecal oral route diarrheal infection. So when we look at the average of all water samples across Pennsylvania, here we have Center County, and we can see the colonies per 100 milliliters of water. And so, the average here is 50 to 100, or 0 to 50, or 1 to 50 really, here in Center County. Just south, higher numbers. And you can see a few different areas throughout Pennsylvania in which, a lot of these private wells are above 0. And I think that's the take-home message. Whoops. The take-home message is that we're seeing lots of samples in which the E. coli, the number of coliforms is above the recommended amount, which could lead to some gastrointestinal health issues. Now, one of the water quality issues that we most frequently talk about is lead, and that was the big issue in Flint, Michigan. And so if we look at Pennsylvania, where we're seeing the maximum contaminant level above 0.015 milligrams per liter, we can see a few different regions throughout Pennsylvania that have average water samples with lead above this maximum contaminant level. Fortunately, when we look at the percentage of water samples that failed per zip code, the vast majority are, 0 to 25%. There's only, one region really where we're seeing a concerning level, a couple zip codes. And then finally, another water quality indicator that is commonly examined in environmental health is arsenic, because it can negatively affect kidney function, kidney health. And so when we look at arsenic, which is frequently naturally occurring, it's in soil, we can see that the maximum contaminant level is 0.01 milligrams per liter. And if we look at the percentage of water samples that failed per zip code, the vast majority are zip codes are 0 to 50%, and then there's just a few places that had fewer than 10 samples where all of the samples failed. Essentially, what this is showing us is that, in Pennsylvania, our concerns are legitimate in terms of protection for private water quality. There's also other contaminants of emerging concern, like forever chemicals, PFAS and PFOAs. These are a group of chemicals that are used to make fluoropolymer coatings and products that resist heat, oil, stains, grease, and water. And those are in a number of things. Luckily, the EPA finally said that we need a limit on PFAS and PFOAs at 4 parts per trillion. So that's a huge step in the right direction. This past July, they announced that unlike some of the previous research, they were starting to recognize that there were real health concerns of PFAS in drinking water at levels far lower than what they had previously said. And so that was one of the reasons why these recommendations have now taken place. So now I want to transition to one of the last parts of the talk, which is the systematic literature review that my graduate student and a couple of my undergraduates conducted in terms of trying to understand what's already been examined as it relates to private water in Pennsylvania, how it's associated with social perspectives and human health. So one of the things that we study when you do a systematic literature review is you have to put in a series of search terms, and we wanted to understand both social perspectives and human health. So these were 2 separate systematic literature reviews between 1970 and 2020 to see what all has been studied in Pennsylvania. We found about 10 published articles about water insecurity and social perspectives in Pennsylvania, and then 16 articles that looked at human health and water in Pennsylvania. Many of the studies found were not actually specifically about private water, so it's a small portion of the overall study. In some papers, there wasn't a clear separation between public and private water sources. And in these cases, we're pulling out what was applicable to both, but aren't really able to answer many of the questions. So what are some of the preliminary findings from the literature review for household water use in Pennsylvania? Well, from private water sources, of the 10 studies that we found, the majority of them were on household wells. Some of them, one study was on roadside springs, and then 4 of the studies talked about multiple water sources, like people using wells and springs. Another key aspect that we pulled out of the systematic literature review was, what are people doing about water quality? So what type of coping mechanisms are they using? And what we found was that people often are purchasing bottled water when they're worried about it. They're hauling water to their houses, oftentimes from roadside springs. They're treating their water, they're boiling it, or using multiple sources. And then in terms of trying to understand some of the health aspects of them, what are the causes of water insecurity in Pennsylvania among private water users? Well, we found one of the biggest things was industry and development. So fracking showed up as a key concern for people that used private wells. They were worried about the impact of industry and fracking on their water quality. Some of the water beliefs that we found were things like water governance, environmental injustice, water equity, economic injustice and risk. And then when we tried to understand the impact on mental health, what we found was that oftentimes this was something that people discussed as a primary concern, and it was implied in the research, or explicitly discussed. So what's next for us? Next, what we're going to do is we're going to launch a survey in Pennsylvania to do 2 things. We want to understand what are the causes, what are the predictors of trust and distrust of tap water, both among private water users as well as in urban areas like Philadelphia and Pittsburgh. We also want to understand social disparities, both in terms of socioeconomic status as well as race and ethnicity. And we want to understand, how is water insecurity affecting the physical and mental health of residents in Pennsylvania. So we're going to be using these household surveys, getting more water quality data, and then linking it to health outcomes. And so with that, I just want to thank, my lab that has been very involved, Leslie Ford in particular, as well as my undergrad, City, Caitlin, Maddie, and Erica. And then, of course, my collaborators, Laura, Andy, Brian, David, Mari, and Ryan, who did the mapping. All right, with that, I'll open it up for questions. Thanks.
Yeah, thanks so much, Asher. We certainly appreciate all the information. It's really, I got to tell you, like personally, it's very staggering to see some of the, some of the charts that you had and how much water, issues or how much work that still needs to be done in Pennsylvania, for sure. And with that, I'm going to go ahead and stop the recording